Dr. Regina Rodman here, and we are going to talk today about the risks of a brow lift. Now, the brow lift that I am talking about specifically is one that I often do in association with a hairline advancement. There's a few different types of brow lifts. The one that I do most commonly is with a hairline advancement, so that is where I already have a big incision across the forehead. It's also possible to do a brow lift endoscopically, and that's where there's just a few small incisions inside the hair. That one tends to be less visible, but a slightly less result. But it doesn't really matter, any surgery, anytime, especially the brow lift, similar risks. So the risks with the brow lift, any surgery, anytime, bleeding, scarring, infection. Now, bleeding risk with the brow lift is pretty low, but it is real, and that's why I have patients stay 2 nights after surgery, so that if something does happen, I can be the one to take care of you. I can be the one to treat it. Scarring, the scarring really depends on the approach to the brow lift. So if you are doing it with a hairline advancement, then that is a very big incision, and watch the previous video about hairline advancement to learn about that scar. Also possible to do a brow lift through a coronal incision, and that's where we put a pretty big incision actually right behind the hair. It hides really nicely in the hair, but there is a risk of hair loss. The other type of brow lift is an endoscopic brow lift, which is just usually 5 small incisions in the hair. They start and end a few centimeters behind the hairline. Still a risk of hair loss with those, less so, but anytime we're making an incision or a cut in the hair, there's a risk that some hair falls out around there. Other risks with a brow lift, the big scary risk is damage to the frontal branch of the facial nerve. So there is a branch of the facial nerve that runs right here through the area of the brow. Now, I know where that branch is. I know which plane it lives in. I know how to avoid it. So the risk of damaging that nerve is low, but it's not zero. What I have seen in real life is I have not seen that actually be paralyzed or cut. I have seen in a few rare examples where that nerve is a little sluggish or a little bit weak after surgery. I think what happened was probably trying to dry up a blood vessel, a little bit of heat from the cautery maybe bruised that nerve, and so temporarily it was weak afterwards. That's a risk. It's low, but that's probably the scariest thing, and the thing that I'm always have on my mind that I'm trying to avoid when doing a brow lift. Other risks of a brow lift, a little bit of brow asymmetry. Now, this is a risk, but also somewhat of a guarantee. Everyone has asymmetry in their brows. If you look at me closely right now, this eyebrow is higher than this eyebrow. That's just the way I am. That's the way I was born. Everybody has one brow that's a little higher than the other. So if you're doing a brow lift and one brow is significantly lower, I certainly take note of that, and I can try to pull that side up to help correct it. It will make it better, but it will never be perfect. And the reason for that is because the 2 sides of the face are different from birth. And so the 2 sides of our forehead, one side of the bone is slightly bigger, one set of muscles is slightly bigger or stronger, and will always be that way. So I can lift the brows so that at rest, the 2 brows are better and more even. But if you have one muscle that's stronger, it will always be a little stronger, and that brow will always be a little bit more dynamic, and they will never be perfect. And now we're talking about a level of asymmetry that probably the patient notices and nobody else notices, because everybody is a little asymmetric. I also find this is something that if we talk about it beforehand and I point out which brow is a little higher, we talk about it beforehand, it's not a big deal. But if we don't discuss it beforehand, then patients notice it afterwards because they're looking for their results. It becomes more of an issue. Other risk with a brow lift, asymmetry, potential a little bit of numbness, depending on the approach that we use. The whole brow may just feel a little bit numb temporarily. That usually goes away pretty quickly within a few weeks. And those are the major risks associated with brow lift. Now, this can also be done with brow bossing reduction and orbital rim reduction, which we'll talk about in the next video.